In the next 15 minutes, or likely less, I would like to reflect on One Health concept and its relevant for public health and health protection work in particular, outline some of the current AMR challenges in Victoria and what we are doing to address them, and to discuss the key consideration for setting an effective One Health surveillance system. The goal of One Health approach is optimal health outcomes. There are two components here. One is recognizing the interconnectedness between people, animal, plants, and their shared environment. And the second is about collaboration and cross-sector action. Working in health protection, One Health concept is very relevant and describes accurately the work that we do on a daily basis. Here is a selection of Victorian Chief Health Officer advisory and alerts that were released over the last few years, and highlights the variety of hazards and risks that we have to address in order to protect the Victorian community. Zoonoses, foodborne outbreak, resistant organism are a common occurrence. And for each and every one of these risks or issues identified, a comprehensive investigation needs to occur where multidisciplinary input is required. And response always involves multiple stakeholders, the Department of Health, other departmental government departments, and key stakeholders. We cannot respond to these complex challenges alone. We do need partners. So that collaboration and trust, building trust between various organizations and key stakeholders is key in responding to these ongoing challenges. Looking at the AMR burden, this is a public health priority. The rising tide of AMR, it is of high concern for public health, and inaction can result in significant increase in mortality and significant costs associated with healthcare. For us in public health, we tend to look at the bigger picture all the time. And AMR is definitely one of the biggest communicable disease challenges of our time. It threatens many advances in modern medicine and affecting the entire community, with the most vulnerable groups likely to be most impacted. It also affects animal health and food production and food safety. And looking at other challenges like land use, agricultural practices, climate change, population growth, international travel, and the global economy, all these are interconnected and are amplifying the consequences of AMR and communicable diseases threats more broadly. In that connectedness also lies opportunity for identifying actions that can influence and address more than one of those challenges. So this is our challenge in public health, to identify those actions. A quick look at AMR in Victoria. It is a growing problem here as everywhere else across Australia. The list of pathogens with AMR concern is growing, and some of the well-known pathogens, such as tuberculosis, gonorrhea, typhoid, are increasingly impacted by resistance. In 2019, we've added 5 emerging pathogens on our list of communicable diseases due to their potential impact on health services and AMR concern. One of these pathogens is CPE, carbapenemase-producing Enterobacterales. This group of bacteria are emerging. The majority of cases continue to be imported. However, we're seeing an increasing trend of outbreaking and local transmission in health services. This can have a significant impact on service delivery and patient care with very significant costs. Timely investigation and response here is very important. Just to give you an example, in terms of costs, if you have a large outbreak in one of the specialized services, let's say the intensive care unit ward with 45 beds, if you have to close that particular ward, will cost more than $230,000 a day and more than $7 million a month. So the costs are very, very significant. Our team here in the department, AMR unit, is responsible for all key elements of public health response: surveillance, investigation and response, and proactive health protection. Surveillance helps us to analyze trends and to identify emerging pathogens, but also to identify outbreaks early. And the investigation part of our work is where our detective work occurs at its best. Epidemiological and laboratory investigation help to identify outbreaks and to implement controls measures early. And whole genome sequencing has become an indispensable tool for us to identify clusters and outbreaks. We are increasingly involved in proactive health protection through education, cross-sector engagement, and more recently, developing evidence-based policy with the development of Victorian AMR strategy, our priority project. One Health approach is required to respond to the AMR threat. We need a longer-term vision and clear cross-sector objectives and priority for action, and this is what we're trying to achieve with the Victorian strategy. We aim for the Victorian strategy to be aligned with the national strategy, but also to identify Victorian specific priority for action, and would like to attach implementation plans and measure for success to our strategy. A quick look at surveillance systems. Surveillance systems for AMR have developed in isolation in each sector, in animal health, in human health, and they're usually focusing on identifying resistant organisms and antimicrobial, and they're looking at resistant organism antimicrobial use. Developing an integrated health surveillance is a key priority both under the national and the Victorian strategy. It is very much needed. However, it is going to be a very complex undertaking. And I think it's useful to go back to the definitions for surveillance and for One Health surveillance. I've listed them here on the screen to help us focus and understand some of the challenges. To set up an effective surveillance system, even for one condition or one organism, needs very careful consideration. And you have to start with identifying the purpose, the characteristic that will make an effective system. Look at how that system is going to operate and what are going to be the outputs. And related to the definition of surveillance, the output needs to be information for action. You need to be aware of your stakeholders and what the stakeholders are going to do with that information, what actions are going to be influenced, and what are going to be the final outcomes to assess the impact and the value of your surveillance system. With One Health surveillance system, it's an entirely different level of complexity to set up, to identify the purpose, what data is going to be collected, what would be the priority pathogen, who are the stakeholders. In terms of effectiveness, there are a number of characteristics that are usually considered for a surveillance system. Timeliness, this is particularly relevant for providing information quickly and being able to identify outbreaks. Providing useful information, it's again that notion of information for action. You need to have flexibility to account for any emerging pathogen and any changing in circumstances and what you want to survey and measure. Acceptability is very important for those who are meant to report into that system, those who are collecting data, and most importantly, those that are going to be the end users. And there are complexity when that needs to happen across a number of sectors. Stability is another important attribute, both in terms of having good database and platforms, so the system is not crashing every day, but also stability in terms of longer term operation of that systems to be able to start to see some impact. Measuring the One Health dimension and the integration of a system is difficult. It is a new part. It hasn't been evaluated properly, but there is some promising work in that regard and something that will need to be increasingly addressed. One Health dimension, it's more than data sharing. It is about analysis to provide a holistic, multidisciplinary, multi-perspective understanding of the MR problem. Looking at the operation of a One Health systems or of a One Health system, governance is very important, and having clarity of governance, data collection, storage, analysis, and reporting. Last but not least, cost and investments are very important, and you have to constantly be able to demonstrate value for money. In terms of outputs, reports, trends, and outbreak detection would be the key ones. And again, looking at the broader impact of a surveillance system through disseminating information to stakeholders who are able to take action, we would hope to see increased knowledge of the MR epidemiology, increased awareness, action in terms of risk assessment, outbreak response, and effective intervention.
Mihaela, that's your 12 minutes.
Thank you. And behavior change. And hopefully you'd like to see some long-term outcomes, reduction of AMR, and improved health of people and communities, animal and ecosystems. Just in summary, One Health approach has direct applicability for health protection action. The rising tide of AMRs requires a coordinated cross-sector response, and the development of a One Health surveillance, while challenging, it is a priority to inform effective cross-sector and sector-specific interventions. That's all. Thank you.